Good evening friends and welcome to my channel. So in my series on the Parotid's question and answers, so this is the third part and we will discuss about the remaining thyroid questions. So first question is treatment of parotid duct stones 4 millimeter, 8 millimeter and above 8 millimeter. So you have to give the options, what are the various options which are available for 4 millimeter stone, 8 millimeter stone and stones which are bigger than 8 millimeter. So there is specific indication, though these indications may cross over from one size to other depending upon the difficulties one faces in extracting the stone. But many times these stones can be removed by just judging the size of the stone on ultrasound, and we can try to use the first method, which is the preferred method. Second question is pleomorphic adenoma patient is a malignant or benign potential. So this is about the pleomorphic adenoma of the parotid. It is you have to give answer that whether it is a benign tumor or it is a benign tumor with malignant potential. And you have to also give why it is, if you say that it is a benign with malignant potential, you have to give the answer for that also. Then third question is most common complaint associated with the parotid gland. So you have to give the disease in which the parotid is commonly involved. So that may be viral infection, that may be your inflammatory any problem, or you can say the abscess formation or the tumor. Question number 4 is mumps is a viral or bacterial infection. So you have to give the answer. And then fifth question is prodromal symptoms of mumps are. Prodromal symptoms means when somebody has acquired the infection through droplet route or whatever route it is. So when before producing specific symptom for the mumps, that is the enlargement of the parotid glands and other symptoms. So what are those prodromal symptoms which patient develops after acquiring the viral infection? What is the role of antibiotics in the mumps? So you have to specify the role of antibiotics in the mumps, whether during the acute phase of the mumps or in the after the acute phase is resolved. If there is any role, then what is the role of those antibiotics in mumps? Then is what is the mode of spread of mumps? You have to give the specific mode of spread of the mumps disease. Eighth is mumps usually involve and occur in. So you have to give which is the common site where the mumps occur, and in usually common in, that means you have to give the age group in which it is more common as compared to the others. Then ninth question is atypical viral parotitis typically occurs in bilateral or unilateral. So you have to give this whether it is a bilateral or unilateral. Some parotid infection usually occurs in both glands, that is a bilateral involvement, but some involve you can say the unilateral, more common as compared to the bilateral. Then the 10th and the last question is in mumps parotid immunity occurs for 5 years, 10 years, or it gives you a lifelong immunity. So you have to think over it how long the immunity persists once the patient acquires the infection. So these are the 10 questions you have to answer, and tomorrow I will post a video in which these answers will be given. Thank you very much, and please don't forget to subscribe my channel and share with your friends who also require this kind of information. Thank you very much.